Today we are going to start with sulfonamide. For any antimicrobial, we will be writing our answers in a pattern. First of all, we write classification. After classification, we will be writing a short definition. And then after definition, we will be writing about the antimicrobial spectrum, like what are the antimicrobials, what are the microbial agents against which this ड्रग्स विल हैव एन इफेक्ट. तो हम लोग इसमें एंटी माइक्रो कौन कौन से ऐसे मतलब कौन कौन से ऐसे ऑर्गेनिजम्स हैं जिसके अगेंस्ट दिस ड्रग विल वर्क. एंड देन वी विल इंक्लूड द पॉइंट ऑफ रेजिस्टेंस इफ़ देर इज़ अ सिग्निफिकेंट पॉइंट. अगर कोई रेजिस्टेंस का कोई सिग्निफिकेंट पॉइंट है तो हम वो ऐड करेंगे. एंड देन वी विल मोस्ट इम्पॉर्टेंट इज मैकेनिज्म ऑफ एक्शन. उसके बाद वी कैन यू ऐड थेराप्यूटिक यूजेस एंड देन ऑफकोर्स एडवर्स रिएक्शन. अगर कोई इंपॉर्टेंट रिएक्शन है तो हम वो ऐड करेंगे. सो दिस इज़ द ये जो है मेन टॉपिक्स है फॉर एनी एंटीमाइक्रोबियल्स. So now let's start with sulfonamide. See, classification of sulfonamide, we will be classifying it into 4 types. Number 1 is short acting. For short acting, see, there is sulfadiazine and sulfasoxazole. So see, dia is so short, so short acting. Dia so short, so dia so short. So they are fast acting, they are very short acting. Sulfadiazine, sulfasoxazole, and these are short acting. So matlab they are so short. And then intermediate acting means middleman M, methoxazole, moxazole, and also pyridine. So sulfamethoxazole, sulfamoxazole, and sulfapyridine. Now long acting. So see, long acting, this is a very long name. Sulfamethoxyrazine, long name, and docs, long documents, long docs. So also long acting. So sulfamethoxyrazine and sulfadoxine. And for the special purpose, see, for the eyes we use sulfacetamide sodium for the eyes. And for the burns we use marfinide and silver sulfadiazine. See, in Gujarati, daji means burn, so we use silver sulfadiazine for burns. And see, okay, so that is what we will be using. Again, to summarize, short acting sulfadiazine, sulfasoxazole, short acting dia so short. Intermediate acting middle person, sulfamethoxazole, sulfamoxazole, and also sulfapyridine. And long acting, long word, sulfamethoxyrazine and sulfadoxine, docs, long documents. And special purpose, for eyes we use sulfacetamide sodium, and for burns we use silver sulfadiazine, dazigai burns, and marfinide burns. And that's all. Okay, now we will move to the discovery definitions. So it was the okay, so this sulfonamide was the first antimicrobial agent. Domhak was a scientist who used protonsil red, and protonsil red was nothing but sulfonamide, like a form of sulfonamido-chrysoidine. So this Domhak used protonsil red to treat streptococcal infection and staphylococcal infection. Okay, and this protonsil, when go in the body, will convert it into sulfanilamide, and that sulfanilamide will be the antibacterial agent. This is the structure of sulfanilamide. See, this first NH2 is for solubility, potency, and pharmacokinetic property. Not important, but this fourth NH2 is very important because it has the antibacterial property. This is the structure of sulfanilamide, and all the sulfonamides are derivative of sulfanilamide. Okay, so our classification is done and our definition part is done. Now we will move for the antimicrobial spectrum. For antimicrobial spectrum, see, In book this is given very hodgepodge, like it is sensitive to Haemophilus influenzae, and it is sensitive to Haemophilus influenzae, Ducrei, Vibrio cholerae, chlamydia, trachoma, under chlamydia, trachoma, actinomycetes, nocardia, toxoplasma, and these are the resistance. It was useful earlier, but now is it resistance, like staphylococcus, gonococci, meningococci, E. coli, Shigella. See, and an anaerobic is not susceptible. But if we use it like if we classify them against gram positive, gram negative bacteria, then it will be easy for us to remember the spectrum. So for that we will do it like this. See, for antimicrobial spectrum we will be doing it in this way. See, this sulfonamide is a broad spectrum antibiotic, means it is a bacteriostatic agent against gram positive, gram negative, atypical, as well as some protozoa. So for gram negative it was streptococci, staphylococci, and actinomycetes. Okay, for gram positive it is streptococci, staphylococci, and actinomycetes. For gram negative organism, it is Haemophilus influenzae, Haemophilus ducrei, Vibrio coli, E. coli, Shigella, gonococci, and meningococci. See, for gram positive, streptococci, actinomycetes, and staphylococci. However, I have written this R here. It was susceptible, but now it is resistant. Same in the gram negative bacteria, Haemophilus influenzae, ducrei, Vibrio cholerae. They are susceptible, but E. coli, Shigella resistant. Gonococci, meningococci also resistant. Now atypical, chlamydia, Trachomatitis, and nocardia. Both are atypical and they are still susceptible. Protozoa, toxoplasma, but we don't use sulfonamide alone. We use it with combination of pyrimethamine. Okay, and for anaerobic bacteria it is not susceptible. Why? Because it utilizes preformed folate. Means that reason is not important for now. Just remember that anaerobic bacteria are not susceptible to sulfonamide, and this will be understood after we do the mechanism of action. Now for mechanism of action we will be doing, it is very simple. See, what is important, it is a bit complicated here, but what is important is that we have studied it, folate synthesis. It is basically folate synthesis. It is sulfonamide will inhibit this folate synthesis. How? The sulfonamide is actually a structural analog of PABA, and it will compete with this enzyme folate synthase or dihydropterate synthase. See, what happens in the normal situation, this GTP will make dihydropterine pyrophosphate, which will add to PABA, para-aminobenzoic acid, and it will form dihydropteroic acid under the enzyme dihydropterate synthase, or easy to remember, folate synthase. So this sulfonamide will inhibit this enzyme. Why? Because this PABA, see, this is the PABA and this is the sulfanilamide, like sulfonamide, get it? So this have this so much of structural similarity. Because of that it will competitively inhibit with PABA, and this enzyme dihydropteroid synthase or folate synthase is inhibited. So it will decrease this dihydropteroic acid, in turn decreasing dihydrofolic acid, and in turn decreasing the tetrahydrofolic acid. So first step itself is inhibited, so all the steps as a domino effect are also inhibited. So it will produce bacteriostatic effect. Why? Because DNA synthesis is also decreased. So for this mechanism of action you have to remember this line. This is very important. Sulfonamide is a structural analog of PABA and it will compete with folate synthase enzyme competitively inhibition. Okay, and so you have to remember this step and how folates are reduced. Okay, now why this sulfonamide is working? First of all is the structural analogy, second is enzyme interaction we studied here, and third is selective toxicity. Now it will not affect the humans, it will affect only bacteria. Why? Because humans are getting the folic acid from the diet, so it will be, drug is selectively acting only on bacteria. Now now, as I mentioned, sulfonamide is bacteriostatic, not bactericidal. Why? Because it is binding covalently to the enzyme, and the binding is not permanent. It is not permanent. It is temporary binding. And as we know that for the, like, see, if PABA is increased, if PABA if PABA is increased, so it will reverse this all process. So it will reverse this inhibition. That's why it is bacteriostatic, not bactericidal. And there is a for like pus. For pus and tissue debris will have high PABA content. So drug will be less effective because increased PABA, so inhibition will be decreased. Because of the competitive inhibition, it can reverse the inhibition, as we studied in biochemistry. Now for resistance against resistance to sulfonamide, it is very important because many bacteria which were earlier susceptible now are resistant for sulfonamide, and hence sulfonamide is rarely used alone. Now it is mostly used in combination. So for resistance, see, bacteria gonococci, it is bacteria gonococci, also meningococci, E. coli, Shigella. Okay, gonococci, meningococci, E. coli, Shigella, Staphylococcus, Streptococcus pyogenes, Streptococcus viridans, and anaerobes, and pneumococci. So see, these bacteria are now resistant. See, gonococci, meningococci, Shigella, Streptococcus viridans, Streptococcus pyogenes, and Staphylococcus and anaerobes. These are resistant to sulfonamides. Why they can be resistant? These are the possible mechanisms. Either they can produce increased amount of PABA, or they can this folate enzyme can be less susceptible. Like this folate synthase enzyme can have low affinity to sulfonamide. Means even if sulfonamide are present, even if folate synthase enzyme is present, it will not be like having affinity. See, what happens is, normally PABA will having this friendship with enzyme dihydropteroid synthase or folate synthase. But instead of PABA, what happens? Instead of PABA, sulfonamide will form bond. Now, if this dihydropteroid synthase is very loyal, it will say, I will only form bond with PABA, not sulfonamide. So it will reject the sulfonamide, so it is not susceptible. That's what happening. Low affinity for sulfonamide but high affinity for PABA. Adopt the alternative pathway in folate metabolism. And cross resistance is possible amongst other sulfonamide, but not among other antimicrobial agents. So if one sulfonamide agent like sulfoxazole, like there is resistance against sulfoxazole, then it is possible that the person is also resistant towards sulfidoxime. Then another. Now we will study some drugs individually. We don't need to remember everything given in textbook, but these are some important points which I have noted. So see, first point is sulfoxazole. We know sulfoxazole is so short acting. See, dia so short. So it is short acting, sulfoxazole. And see, sulfoxazole have SO. So SO for short and SO for soluble. Sulfoxazole is the most soluble sulfonamide. So it has minimal crystalluria. What is crystalluria? See, what happens is, these sulfonamides, when they get metabolized, they will produce acetylated compounds, metabolites. And these acetylated metabolites are insoluble in urine. So they will form crystals, and that's why it can call crystalluria. But since sulfoxazole is soluble, so it will produce minimal crystalluria. That is one of the advantage of sulfoxazole. Then second is sulfadiazine. Again, dia so short, diazine short acting drug. It is drug of choice for toxoplasmosis with pyrimethamine. So we use for toxoplasmosis we use sulfadiazine plus pyrimethamine. Okay, now sulfamethoxazole. See, middle, intermediate. This is an intermediate acting drug. How? It is used in combination with trimethoprim, and its acetylated metabolite is insoluble in urine, and it can cause crystalluria. See, compare it with sulfoxazole. It was minimal crystalluria. Why? Because soluble. And this sulfamethoxazole, it is insoluble. Why? Causing crystalluria. Sulfadoxine. Sulfadoxine, see, long documents, long acting. Long name, sulfamethoxyrazine, long acting. It has duration of action more than 1 week. Why more than 1 week? Because of the high plasma protein binding and slow renal excretion. Now this drug is combined with pyrimethamine. Why? It is very important. It is used for chloroquine resistant P. falciparum malaria, and also for mefloquine resistant malaria, and also for the pneumonia, pneumocystis cerevisiae pneumonia, and also for the toxoplasmosis. So see, it has many uses. One is malaria, be it chloroquine resistant P. falciparum malaria, mefloquine resistant malaria, P. cerevisiae pneumonia, and toxoplasmosis. And it is only used on high risk cases. Why? Because there is very high chance of allergy, like Stevens-Johnson syndrome. And moreover, it is not used for acute infection. Why? Because of the low plasma concentration achieved. It is subclinical, like not subclinical. It is, the plasma concentration is very low, so it will not be like having its effect for acute bacterial infection. It can be asked in short question also, like for reasoning, why we are not using sulfadoxine or sulfamethoxyrazine for acute bacterial infection. Because of this reason, low plasma concentration achieved. And it can also be asked in a short question that why sulfadoxine and sulfamethoxyrazine are long acting. Because of them, it has duration of 1 week. Why? High plasma protein binding and slow renal excretion. Okay, and for uses you have to remember this: treatment of chloroquine resistant P. falciparum malaria, mefloquine resistant malaria, pneumocystis cerevisiae pneumonia, and toxoplasmosis. Okay, now sulfasalazine. Salazine is used for ulcerative colitis and rheumatoid arthritis. Sulfacetamide is used in eye. Okay, this is a topical drug. It is used for as ointment. How? Ointment. Now see, it is used as ointment. Why it is used as ointment? It also can be a short question. It has a high aqueous solubility. The pH of this solution is 7.4 even at this much strength. 30%, we can use this ointment till 30% of concentration. After that it is irritant to the eye, but till 30% strength we can use it. It has a pH 7.4, so it is suitable for ocular use, and it is non-irritant to eye. So there are 3 reasons. One is solubility, second is suitable pH, and third is non-irritant. That's why it is used for topical treatment of eye. Now sulfacetamide sodium, as we studied, it is used for ocular infection, chlamydia, and trachoma. Trachoma is a type of infection caused by chlamydia as well. Like we studied, chlamydia trachomatis is susceptible to sulfonamides, so it is used for chlamydia infection, trachoma infection. Now silver sulfadiazine. Now silver sulfadiazine is used as 1% cream, and it is used against pseudomonas. See, other sulfonamides are resistant to pseudomonas, but this is special. This can act against pseudomonas. How? Release of silver ions, and it will prevent the infection of burnt surface. See, daji gaya, burnt surface, and also chronic ulcer. Now marfinide is also used for burns, and it has for extra information I can tell you this is not written for exam. You just have to remember marfinide used for burn, but for extra knowledge I will explain to you. If you read the books, you will know Mafenide is basically alpha amino p toluene sulfonamide, a sulfonamide basically. Now when it goes into the body, it is converted into metabolite para carboxybenzene sulfonamide. Okay, another sulfonamide. So toluene to carboxybenzene. Now this will metabolite can cause many adverse effects. Okay, for adverse effects like burning sensation, super infection with candida. Okay, you can remember it by yourself, but this is very interesting. Urine becomes alkaline and its metabolite will inhibit carbonic anhydrase, so it will cause acidosis, and it will also cause compensatory tachypnea or hyperventilation. Okay, and it is not used for well established infection, it is only used for the burns. Okay, now this is something which is extra, so I will tell you this at the end of the video. Okay, why this metabolite is causing these last three adverse effects. So if you want to say it, you can see the last 1 to 2 minutes. I will explain it in the end. Okay, now for uses, this is very important. This uses part is very important. You have to write this in exam. See, this individual drugs part I have explained. You can or you cannot even skip it for writing, but you have to understand it, because even if you have to know a bit gist. So if you have time in exam, you can write just one line of each drug which you find important. For uses, we write see, sulfonamide is very rarely used alone now. Uses, for uses, sulfonamide is rarely used alone now because of its resistance, but it can be used alone for as sulfacetamide sodium for ointment, eye ointment for chlamydial infection, trachoma infection, silver sulfadiazine, mafenide for burns, and sulfasalazine for ulcerative colitis and rheumatoid arthritis. See, how can you remember this sulfasalazine? You can remember it, sulfasalazine causing, see, you can remember it by TKMOC, Sundar Sala. He causes stomachache and joint pain. Stomach, you can remember ulcerative colitis, and joint, you can remember it rheumatoid arthritis. You can remember it like that, ki Sala causes pain in the stomach. He did not let Jethalal eat properly, and he even did not work him properly, caused the joint pain because he had to run a lot. Okay, so you can remember it that way, that sulfasalazine, ulcerative colitis and rheumatoid arthritis. And then sulfonamide, now see, we used combination more for malaria. So for malaria, we use sulfa doxine, that is long acting, and pyrimethamine for malaria, and sulfadiazine for burns. Okay, and for toxoplasmosis also we use sulfadiazine plus pyrimethamine for toxoplasmosis, which is a protozoal infection, and cotrimoxazole for pneumocystis jirovecii pneumonia, which is basically the combination of trimethoprim and sulfamethoxazole. So that's it for uses. Now basically the video is over, but if you want to adverse effect is still left. It is also very important, adverse effects. See, the basic adverse effect, GI adverse effects, nausea, vomiting and epigastric pain is very common, but the important are the ones I have highlighted. Number one is crystalluria, as I have explained, because of the poor solubility of the sulfonamide and the acetylated metabolite in acidic urine, the crystals are formed because of the insoluble acetylated metabolite. So how can we prevent it? First of all, you can use sulfoxazole because it was soluble. It was okay. Or you can use you can increase its solubility by making urine alkaline, or you can increase the fluid intake. But you have to basically remember that adverse effect, crystalluria is one of the important adverse effects. Second adverse effect is hypersensitivity reaction, and hypersensitivity reaction can entail rashes, drug fever, or drug fever. But important is rarely Steven-Johnson syndrome can happen. Then is hepatitis in 0.1% patient. G6PD deficiency, very important, hemolytic anemia at high dose. This is also dose related. This will happen at high dose, and this is also dose related. Okay, others are not dose related. Connectors, see it happens in fetus and neonates because of the blood brain barrier is not developed yet. So bilirubin can cross the blood brain barrier and deposit the bilirubin in brain, so it will cause kernicterus. And also hypothyroidism, goiter, arthritis, drug fever on prolonged use. Now antibacterial spectrum, we have already discussed this. For the extra knowledge, I have said if you are reading the textbook very properly, you will note that in the KDT and also in the other textbook it is written mafenide applied for the burns, it will cause the very interesting adverse effects. They will like cause urine alkaline, they will cause metabolic acidosis, and they will also cause tachypnea, hyperventilation. Okay, so these were the side effects, and you will not be able to understand this side effect unless because these are all connected. So see what happens ki mafenide, we use it for burns. Normally you have to understand only this, but if you want to know more what happens ki if when mafenide is metabolized to paracarboxybenzene sulfonamide, and this will inhibit carbonic anhydrase. So in the kidney, see, we know carbonic anhydrase will convert CO2 H2O to carbonic acid, and carbonic acid again carbonic anhydrase will secrete H plus and will reabsorb H3O minus, means bicarbonate ions. So now if we are inhibiting this, so this secretion will decrease and this reabsorption will increase. Reabsorption will decrease and secretion will also decrease. So because of that secretion is decreased and bicarbonate reabsorption is also decreased. So bicarbonate will be lost in urine, so as it is not reabsorbed back, so urine will become alkaline. So first is done. Okay, body is already losing bicarbonate, so body is losing base, so blood is becoming acidic, so metabolic acidosis is happening. And because metabolic acidosis is happening, our body will try to expel out CO2 also, because CO2 is also acid, so that will cause hyperventilation, and that is a, like you can say, compensatory mechanism. So that is why hyperventilation or tachypnea will happen. That's it, the video is over. Thank you very much.